You're kind of worried, obviously,
Yes.
about being a whistleblower.
Yep. The consequences would be huge if I was caught doing this. These are children in care of the government.
So there's a big wall of security cameras in the facility, right?
Let's watch what happens.
Oh, Melanie, that is appalling.
If I did this to my child at home, Oranga Tamariki would likely remove my child.
I'd call that an assault.
Morning.
Good morning.
How are you?
Nice to meet you.
Pretty early.
Yes.
It's interesting out here. You like the horses?
You love my horses?
So we're all in a fairly kind of clandestine situation. We're in a secret location, but you're kind of worried, obviously,
Yes.
about being a whistleblower.
Yep. The consequences would be huge if I was caught doing this. I'd lose my job. Some of the staff would obviously want retribution, I imagine.
And so you've got this footage?
Yes. I've got a friend's place I can take you to, and we can have a look at the footage there, and you can see what you think. So I'm going to show you video of restraints on kids at a care and protection unit. You may see them and think they're not actually that bad, but I want you to remember that these are children in care of the government. These are our most damaged young people that we're trying to help.
They're New Zealand's most vulnerable children.
Yes, and although they have disturbing behaviours, or behaviours that can be very challenging, we're not allowed to do anything that the public is not allowed to do.
And I guess there will be a point of view that, sometimes restraints can get out of control and that on the ground and in reality, you can't always follow procedures to the letter of the law.
Yes, that's a good point. We come from a rugby playing nation where we're used to knocking people around and we have a bit of rough and tumble.
Yeah.
But these are people who are employed to care for our most vulnerable children and young people. We're supposed to be showing them another way of living, another way of being, different from the abuse and trauma that they've suffered prior to coming into our care.
The young people our whistleblower is talking about are housed in what's known as care and protection units run by Oranga Tamariki. These are secure facilities for children aged between 8 and 16. There are 4 residences throughout New Zealand. All the staff are trained in non-violent crisis intervention, a technique known as MAPA. Since you've contacted me, we've sort of thought about a way of doing this, and it's like we will take your voice off
Yes.
and put someone else's voice on to assure your anonymity.
Thanks very much. Look, I'm very concerned that government agencies will want to waste their time finding out who took the film rather than investigating what's actually happening here. Or you're telling people about what's happened, but nobody's listening and nobody's doing anything.
Let's just have a look. So there's a big wall of security cameras in the facility, right?
There's cameras all throughout the facility.
This has been filmed off the monitors.
Yes. So the young person here, there is 3 staff and 1 young person, 13 to 14 years of age. He's obviously fronting up the staff. 1 staff member puts on gloves. These young people are traumatised. They are hypersensitive. The cortisol levels are screaming through their veins. As soon as they see the gloves go on, they either go into fight, flight, or freeze. Basic response.
So he's approaching him.
Yep. Now, that staff member is our MAPA instructor. That is not a MAPA technique. That could have caused serious injury to the young person. This is not mana enhancing practice. This is illegal. 2 staff should put him in a mappa hold so that they can not lash out or strike. But you don't put them on their back and you don't put them on the ground.
So MAPA stands for Managing Actual or Potential Aggression. It's centred around de-escalation. The fundamental principles are care, welfare, safety and security. So no wrist locks, headlocks, avoid going to the ground, and no pain-based restraint. The aim is to calm the person and the situation. So what's going on here?
The staff are obviously trying to get him. They get him off the ground. The staff member going to the door is doing a great job. She's opening the door so the young person can be put through into a safe place. The 2 staff there, the staff member closest to us is going for the mappa hold, and so is the staff member on the other side. This is better. Normally you would walk this young person straight through into secure care if you're able to. Let's watch what happens. The young person is obviously still talking to them. For some reason, he's ended up squashed against the wall. It does not appear that the young person has forced those 2 staff to put him up against the wall.
I want to go back on this again, because what you're saying is, right, okay, we're now approaching what seems to be a mappa hold.
This is a mappa hold.
The door, he's going to be taken through here
Yep.
so he can calm down for a
Yep,
bit.
in a secure
and
room.
they can just take him there.
Yes, but they've pushed him into a wall, and I don't know why they would have him there. It appears they are still talking to him, quite aggressively it seems.
Okay, so now we're going through into the secure area.
Yes, so this is inside the secure timeout room, which is another camera. So you would normally leave the young person here and remove yourselves. I'm unsure why they are still in the room. The young person is starting to struggle, but it appears that both staff have his arms pulled round behind his back. This person is a mappa instructor.
Is he a social worker or a youth?
Youth worker.
So he doesn't have any formal social work training?
No. And this is not a mappa hold. That boy's arm is being twisted at the moment.
So in a normal situation, the young person we put into the timeout room and you just like exit the room and
Yes.
just leave him just to calm down a bit.
Yes, because they've met the grounds for secure, so clearly they are in need of timeout.
So this staff member's gone, and
Yes.
then what's going on here?
Wow. It looked to me like the young boy probably gave them a bit of lip and the staff member threw him to the ground. That could have caused another back injury or head injury.
What do you think when you see this?
Really, really disappointed. I've seen these staff work very well with the young people, but this is disgraceful. They let us down and the whole team down. If you're trying to get the young person into a mappa hold, absolutely fine, but you do not initiate physical intervention until the young person has physically acted out. These are children. 1 child with 3 adult staff members. Can they not manage a 13-year-old boy?
I'd call that an assault.
We asked retired senior social worker Vivian Martini to view the videos. She has spent her working life in a senior capacity in health, mental health, youth justice and care and protection statutory agencies.
What is really important with young people who have been traumatised is that they are also given the opportunity for controlling their situation. They come without any control. When I see that, he was leapt upon, he was taken to the ground, and can I just ask, am I seeing black gloves on that person?
Yeah, you are actually.
Oh, Melanie, that is appalling.
At first glance, though, I suspect there will be those who go, look, these are children that could possibly get out of control, and that perhaps the care workers are doing this to keep themselves and the children safe.
And I suppose that would be an argument that they would use. I would say that these young people have come from a place of trauma. They haven't come into a residence because they're easy children. They've come into residence because there's frankly nowhere else for them to go. They come with fetal alcohol syndrome or anxiety or depression. They come with huge mental health issues, including post-traumatic stress disorder, sexual abuse. These are really vulnerable, very, very needy children.
This is in the school which is part of the residence. This young person has become frustrated with his computer, as many of us do. He's hit the computer screen.
That's extreme though.
And then 2 staff members approach to see what's going on.
Okay.
You can see the staff member on the left-hand side is going for the arm to put the young person into a correct MAPA hold. The staff member on the right, with the white sweatshirt on, has gone straight for a headlock with a young person. This is illegal. The Employment Relations Authority made it very clear, even in our youth justice facilities, headlocks are unacceptable. So,
That's bad,
that
isn't it?
staff member, that's
I know
bad.
that's bad.
The staff member has thrown the young person to the ground. The other staff member, trying to assist, has fallen over trying to help. This, again, is an assault. If I did this to my child at home, Oranga Tamariki would likely remove my child and probably send me to an anger management course. This is just unacceptable. This is for punching a computer screen.
How old do you think this child is?
12, 13.
And what's this woman doing?
She's trying to assist to help the staff.
So this is a different camera, yeah?
Yeah, this is at the other end of the room. Now the staff member is putting his hands on that young person. There is no need to be putting your hands on that young person there.
So they take him outside?
Yes, so this is coming outside the room.
Okay, so we've now got 4 staff members, haven't we? Wait a
5.
minute. So
5
we've got
staff members, 1 young person.
2, 3, 4, 5, yeah?
Yeah,
So bring him and they sit him down.
yeah. So he's in a MAPA restraint now. They are trying to hold him in a MAPA hold, or it looks like the young person has maybe flipped himself back and taken the 2 staff members with him.
But that makes people think, well, that's why these guys have had to take this sort of aggressive stance.
But if you had talked to the young person when he hit the computer screen, perhaps he wouldn't have needed to be restrained. It's very difficult to manage young people when they're firing off. However, the goal is always to look for a MAPA hold. De-escalate them first. Physical intervention is the last resort.
There's 3 things that I have seen young people who come into residence with. They fight, it's flight, or they freeze. Now, if your cortisol levels are going through the ceiling, you're going to come out fighting. There has to be the opportunity for de-escalation, for talking calmly, and certainly for not, and I hope this doesn't sound too dramatic, but for not repeating something that has probably been done to them for years and years and years, which is an adult taking a young person down, hurting a young person.
I've been a social worker for over 2 decades, and I got into social work to help children and their families, to do the right thing by them. Frankly, I'd rather lose my job. If I'm standing by, watching staff members do this to children in our care, I may as well be doing it myself, and I'm not prepared to do that. I'd rather be unemployed.